The newest COVID-19 vaccines rolled out earlier this fall, but not many Americans have shown interest in getting boosted. The CDC reports that earlier this December that only 17% of adults and 7% of kids have received the updated vaccine, which targets more recent virus strains. While hospitalizations in Kansas City have remained relatively low and steady, that could change in the new year as more of us travel and gather around the holidays. Dr. Sarah Boyd is an infectious disease specialist at St. Luke's, and she's here to give us the latest on the coronavirus and other seasonal vaccines. Dr. Boyd, thanks for taking time with us today. I appreciate it.
Thank you for having me.
So what do the numbers tell us, Doctor? How many patients are at St. Luke's for COVID right now?
So across our health system today, we're actually at a fairly steady and low number, kind of in the mid-20s.
Yeah.
And it does fluctuate, day to day and week to week, but luckily we aren't in a large number of patients like we were earlier in the pandemic.
I was going to say, and so that number has been relatively steady the last few months?
Yes.
Yeah. And this is the time of year we typically see a spike in COVID cases. Are you expecting that to be the case this time?
So certainly this is our kind of traditional respiratory season around the holidays when people travel, like you mentioned, as well as, gather together in larger groups than maybe they do on a day-to-day basis. And so certainly we usually do see some uptick in both COVID as well as influenza and other respiratory viruses kind of in that holiday period and just after.
I guess the question is how big of a spike you might expect to see, right?
We're hopeful that we won't see large spikes like we did early in the pandemic with the benefit of people having had illness before, vaccination, kind of awareness of those simple things we do for prevention. But I do think we'll continue to see kind of up and down, kind of little roller coaster spikes of illness.
I mean, given the fact that people are coming together during the holiday season, why wouldn't we see a big spike? I mean, so few folks getting vaccinated again. Why wouldn't the numbers really climb in a scary sort of way?
So I do think with the number of people that have been vaccinated, as well as people being aware and, if they have symptoms getting tested, all of that can go to really helping limit some of those large volume of cases in a short amount of time. But I do think if people don't think about it, get tested, continue about kind of their day-to-day activity without knowing and kind of doing some of that isolation, that risk to the community does increase.
So if someone listening is thinking, hey, I haven't had a booster in a year or so, is there still some protection from that booster? Is that what you're suggesting?
So protection for severe illness, for winding up in the hospital or needing medical attention, the vaccines are fabulous for prevention of that severe illness or death. The vaccines don't necessarily prevent all infections, and kind of with influenza vaccine as well, there can be some mitigation of how severe the illness may be if you are vaccinated.
Yeah. So. I mentioned in the opening that not many Americans have gotten the most recent COVID-19 vaccine this fall. Do we know, Doctor, why is that? What's keeping folks from getting another shot? I got mine.
There are a lot of reasons that people might be hesitant to get their shot. Some of it's convenience. So I do think we've made it much easier. You can go on vaccines.gov, put in your zip code, and it'll tell you which vaccines are in stock at a local pharmacy to get that. I think some of it is kind of the national health emergency. When it ended, people kind of said, okay, it's over. And even though that emergency response period is over, the illness is still circulating. And so I think it's people just having awareness.
There doesn't seem to be as much urgency this time. What would your advice be as a doctor to someone listening who is thinking, it's been a while since I've gotten a shot?
So anyone who is not been vaccinated with the newest updated thing that came out this fall should go and get their vaccine. That's the recommendation from CDC and public health. Certainly those patients that have other health problems that put them at high risk, so heart disease, kidney disease, they're immune compromised, maybe have a cancer diagnosis, all of those people should be vaccinated because if they become ill, they have a high chance of becoming very ill with it.
What are you hearing from your patients you see at St. Luke's about the latest booster and what's keeping people from getting a shot?
The reasons people are hesitant sometimes to get a vaccine, I think, is really varied. Some people maybe don't see how it impacts them. They feel like they're low risk. Maybe they don't have those health conditions I mentioned. Some of it I think is convenience, or thinking, oh, I'll do that tomorrow, and not just taking that step to get it done. And then I think I think in general we've had a large push of vaccinations, in the last year, and so people trying to kind of keep up with what's that newest recommendation, and does that apply to me, is also part of it.
Yeah. Jackson County on this side of the state line and neighboring counties have had a hard time getting their hands on the new vaccines this fall. Could that delay or potentially discourage people from getting shots?
I think that we know with most medical care in general is that if it's easy, accessible, it's affordable, it kind of fits into your day-to-day activity, that people are much more likely to follow that advice and get the prevention done that they need. So,
I mentioned as I introduced this segment, Doctor, that as of earlier December, 17% of adults and 7% of children have received the updated vaccine. How concerned is the medical community when you hear those percentages about these vaccination rates?
Certainly with this pandemic, it's been evolving. And so we don't know what, a year from now or 2 years from now brings, as some of that immunity from the early vaccine kind of wanes, and what does that look like? And so I think that's where kind of using the best up-to-date recommendations to be vaccinated helps not only maybe your own health, those around you, but the community resources for use for medical care.
Yeah. I should point out that COVID isn't the only vaccine that's out there right now. What other shots should folks think about getting?
So we're in prime season to get your influenza vaccine. That's an annual vaccine, and very similar symptoms to COVID. So if, you can't just say, oh, I don't have this or that, and know which illness you have. So certainly influenza. And then RSV vaccine for high-risk individuals, for those over age 60, as well as they're indicated for women in their third trimester of pregnancy in a certain window. And so certainly asking about those for your healthcare providers.
There are several different shots for RSV. How are they different, Doctor?
So in general, the vaccines for RSV are fairly similar in the sense of their protection and mechanism. And so I would encourage people that need that vaccine, after they discuss with their healthcare provider, to get the one that's easily available to them.
Remind us what RSV is.
It's respiratory syncytial virus. That's a common cold type virus. We usually see in children, there's large spikes of illness that kind of go through the community, kind of in a large wave or peak. But we know that the impact, adults get infected, and that elderly adults can have just as severe as illness and risk for hospitalization as something like influenza.
What are the symptoms? Like influenza?
Cough.
Like the flu?
Yeah, runny nose, all of those kind of respiratory symptoms, which is why if you do have that, you need to get tested so that you can better determine, what you have. And then certainly for influenza and COVID, there are treatment antiviral options.
I was going to say, if you get RSV, can you get the vaccine after that, and would that help?
So it wouldn't help with that acute illness, but certainly for risk, lowering your risk for severe illness or hospitalization in the future.
Yeah. How big of a concern has RSV been at St. Luke's this fall?
So we've had fairly low numbers, but we don't take care of pediatric patients. So this is kind of the adult population, and a smaller number of adults usually wind up hospitalized from RSV. And so I'm not sure about, the pediatric population rates for so far this season.
So you're saying kids are more commonly get RSV than adults do?
Well, kids, I would say everyone can get it, but children often, especially young children, you'll see those large spikes in hospitalizations for RSV, usually year to year. So.
What about the flu? If my numbers are correct, Doctor, it looks like more people have gotten flu shots than COVID shots this fall.
Yes.
Is that common?
I think that's part of what we're seeing with the vaccine involvement for COVID. Influenza's been an annual vaccine, so I think people anticipate and they know, hey, every year this is recommended. And so I think with the COVID vaccine, that's been a bit of the issue, is because there's been updated guidance that comes out and people kind of have to stay on top of that news and knowing, it's time to go get that done.
But at some point here, you're suggesting that COVID shots and flu shots will be sort of this annual thing that you do.
I do believe we'll have to find out what they recommend for COVID vaccination update next fall.
Yeah.
But certainly influenza, the current vaccine type, is an annual vaccine and will always be available in the fall.
I don't want to turn this conversation too dark here, but are there any other diseases on the horizon, sort of like COVID, that has folks like you a little concerned about what could be coming down the pike in the next few years?
So with our society travel, and we're a much smaller world than we were even 20 or 25 years ago, there are always potential emerging infections. I think for us, really being aware of the public health infrastructure, learning from pandemics and outbreaks when they happen and how can we better respond in the next one, that's all critical for how our society and our country and our local cities respond to future threats.
I've seen a lot more people wearing masks lately. Is that something that folks might want to start doing again?
So the basic prevention strategies, masking, certainly if you're high risk or going into high risk settings, is a strategy. The social distancing, being aware of ventilation, we've worked on that with information that came out of the COVID pandemic, as well as hand hygiene and getting tested if you're sick.
Mm-hmm. What should you do if you feel sick? What do you recommend?
So home tests for COVID are still available, and there's actually still 4 free home tests to each address supplied by the government that you can request online, or there's a phone number. You can find all that information on CDC. Certainly reaching out to your healthcare provider for influenza testing if that's needed, or if your COVID test is negative, to check and see what else you should do, especially if you're high risk.
Is there a test for the flu?
There is. It's a nasal swab, but not a home test yet. But I do think, we'll see kind of that evolving over the next few years, because we saw the role and benefit that it provided for people during the COVID pandemic to have that availability at home.
Okay, I know I'm about to ask a question that people have heard the answers to, but maybe it's worth reiterating here. After vaccines, what are the most important steps we can take to protect ourselves and others this holiday season?
If you feel sick, don't go to a large gathering. Get tested, check in, figure out what you have, and don't go, kind of spread your germs around. Mm-hmm. Masking, particularly if you're high risk or in high risk settings where there's lots of people together. And then I think hand washing, social distancing, kind of the simple things that we sort of didn't think about before COVID, those still help.
Squeezing some lotion on your hands that kills the germs, that's still a good idea.
Avoiding touching your nose and your...
Yeah. That's Dr. Sarah Boyd. She's an infectious disease specialist over at St. Luke's. Thanks for running all that down for us, Sarah. I sure appreciate it.
Thank you so much.